Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center. Today we're going to do an injectable treatment using a cannula. So we like to use cannulas sometimes when we want to minimize the risk of bruising for a patient. And in this case, we're going to treat lips. This patient has had lip filler in the past and it caused some bruising, and she has some events coming up, so we want to try to avoid that. So we'll try using the cannula and try to get a nice shape to the lips. There are advantages and disadvantages to all of these things. Sometimes the needle gives us more flexibility in where we want to place things, because we can just be in and out of whatever area we want to be in. With the cannula, it's a specific direction, and usually just one puncture we'll make on the corners of the mouth here, and then we'll be able to place the cannula going upward into the upper lip, and then we'll use the same puncture point to place the cannula under in the lower lip area. So the cannulas are blunt, which means that they are unlikely to disrupt a blood vessel under the skin and then cause it to look bruised. There will still be some swelling just from the procedure, and lips always swell. They usually decrease by about 60% in a week or so. But that's what we are planning to do, and we will get started. So here I'm using a 26 gauge needle and just making a little puncture at the lateral mouth area. And now I am using a 30 gauge cannula. So this is a very, very tiny cannula. It has a blunt tip at the end, and it easily slips under the skin. And I'm going all the way to the edge of her vermilion border and laying down a nice little bit of filler. We're using, in this case, RHA filler, which is resistant hyaluronic acid. There are 3 different strengths of this. We're using a little thinner one, which is nice for the lips. We don't want to make them too voluminous, and this filler can last a little bit longer than traditional HA fillers, and also integrates very nicely with the tissue, so you get less chance of lumping and clumping. And the longer strands also work really well. So I've injected along the vermilion border, I've injected a little bit into the meat, and you can already see a beautiful plumping effect. So even though fillers in the lips usually swell significantly with the cannula, because there's no bleeding, it doesn't cause any bruising, we don't really see as much swelling. So what you get at the end of the cannula injection is pretty close to what the lips will be looking like. So that's also very nice, in that we get a nice immediate improvement. You can already see that her lip lines look significantly better on the right side of her face than on the left side. I am not directly injecting into the lines, but adding that volume around the lips really helps those wrinkles to go away and look a lot smoother. You'll see that in the after photos when we show those to you. You'll be able to appreciate that even more. But it's just a really nice way to fill lips with the cannula, and not in every situation, but in many of our patients we are now offering this. It's also a little less painful because we don't have a sharp needle going directly into the lip. The cannula is just traveling under the skin, and you can see the patient is quite comfortable. She's not tearing up or crying at all in any way. Nobody ever cries, but sometimes you get those tears just from the trauma of the injection. So that's a little bit about cannulas. Of course, we can use them in any part of the body. We sometimes use cannulas to inject Sculptra, for example, in the buttock area, if we want to do a non-surgical volumization of the buttocks. We can use cannulas under the eyes and in the cheeks and in the temples. And also, I like to use Sculptra on the lateral face, and we can certainly use cannulas there as well. Just kind of looking and making sure it's all perfect before we stop. Getting good symmetry to the area. She had a scar on one side that I was trying to fix earlier from where she had an injury and lost part of her lip volume. So that's it, and I think she'll be extremely pleased. She should not really have any bruising. As you can see, there's really no bleeding at all. And the fun part now is showing the patient what it looks like, and then this is before and this is after. And here is a side view before and a nice beautiful lip after. Thank you so much for watching.